I'm reading. Dr. Abdul, it says A. Dr. Abdul Wahid.
Excellent. You memorized my first name. That's awesome.
Yeah. And I think you are terrific. You called me right back on. You gave me your cell phone number. Your secretary. What's her name?
Loanne.
Loanne.
Loanne's actually the manager of our offices, and she's been awesome. She's
bright, beloved, beautiful.
She takes good care of all of us. Without her, the office wouldn't be running.
She called me right back. Left her cell phone, efficient, warm, lovely.
Thank you.
And you did the same, and I so appreciate it.
Thank you.
Tell us a little bit about your background. You're a dentist.
Sure, I'm a dentist, and I've had the pleasure of being on your show several times now.
Yes.
And we were able to disseminate a lot of oral health-related information to the community, which I really appreciate you having me on the show.
And that didn't come out to best advantage for you.
Well, it came out. It was well because we were able to disseminate the information, but unfortunately, last few times I came, we really were trying to lobby Mass Health in retaining the dental benefits, and unfortunately that has been canceled. The majority of it.
Yeah.
But it's important to focus on the positives.
Yes.
So the positive is Mass Health and Commonwealth Care will still cover routine cleanings. They will cover emergency exams. They'll cover the initial exam and all the x-rays. What they will not cover for peoples of the age over 21 is they will not cover any restorative, meaning fillings and dentures and root canals and things like that. But it's important that we still utilize whatever resources are available to us, and in this case it would be the routine cleanings and exams. But for people under the age of 21, Mass Health is still honoring all the benefits that they previously covered, meaning exams, cleanings, restored fillings, root canals, and whatever, the majority of dental procedures that are needed. So it's important, very, very important that we focus on that, focus on the positives, and make sure that our communities are utilizing whatever resources are available to them and whatever benefits have been extended to them.
That is a good way to put it. Aren't you an optimist?
Thank you. Well, we have to be.
Yes.
We have to be. It's a tough economy. Our state is going through a lot. A lot of people are losing their jobs. So it's important that, with the limited resources we have, we utilize it so the state and our representatives are aware that our communities care about these resources, are utilizing resources. If we're not utilizing these resources, we're sending a negative image. We're sending a negative message that, we don't really care for this. This is important for us. This is something the community needs. This is something the community deserves. Therefore, it's important that we utilize it and emphasize the need, the importance that these benefits bring to our families on a daily basis.
And you, tell us about your background.
Of course, I'm sorry about that.
No, I think I love passion.
Sure.
And I think that people who come to you who have Mass Health are damn lucky.
Thank you.
Because you care. You care. You're fighting for their rights and what they should have.
Thank you.
And we all need advocates.
Thank you.
I think it's absolutely wonderful.
Thank
Wonderful.
You. Thank you.
And I know that you came from, was it Tufts?
Yes. Well, I was originally from Hong Kong.
Yeah, isn't that exciting? I said to you,
have
you gone back?
Well, unfortunately, because being so busy and having to see patients and dealing with a lot of issues that our community really needs help with, I haven't really had the opportunity to go back.
But your father's there, right?
My father's there. He's an orthopedic surgeon in Hong Kong.
Orthopedic surgeon?
Orthopedic surgeon,
How
yes.
is healthcare and surgery and everything in Hong Kong?
It's great. It's they have the state-of-the-art equipment, procedures, and materials. But I had the pleasure of moving from Hong Kong to Boston at the age of 17. I attended Tufts. I was a chemical engineer, a biomedical engineer at Tufts. They trained me very well. And then later on, I moved on. I studied a little physics. And then I moved on to Tufts, did my dental degree at Tufts. Moved on to Harvard, where I got my postdoc fellow. And then I went on to teach at Harvard for about 4 to 5 years in association with Brigham Women's Hospital. Me and my partner, Dr. Kashefi, we realized that there was a need for good dental treatment, a need to improve access of care in Quincy. So the both of us, we started off with one chair. We opened up a practice up in Quincy. We grew with no patients. We had nothing. Now we have about 130 to 140 new patients a month.
You're right next to Tom O'Brien in
right.
that
plaza,
mall, in that plaza there, right?
And we've been very lucky and fortunate to develop a second practice down in Cambridge right now, across the street from the Galleria Mall.
Now, all right, so people know where that is, the Galleria Mall.
Cambridge
Okay.
Side Galleria,
Yeah.
right across the street from Best Buy.
What is the specialty in both these places? Is it everything?
The specialty is we care about our patients. The specialty is we are a community-focused dental practice where we are trying to improve access to care. And by doing that, we're trying to create something called a dental home for both adults and children. And that entails providing our patients with a location where the doctors understand their complete medical and dental history by corroborating with their primary care physician, a place where they're able to obtain doctors that understand their needs, provide with them the appropriate referrals, provide them with the appropriate diagnosis, provide them with the appropriate treatment, provide them with options, and overall provide them access with information that they and their family needs.
Are you a family dentist? I mean, you.
I am personally a family dentist,
but you have expertise.
I'm fortunate enough, having been trained at the Brigham, I've been exposed to many of the specialties in dentistry, and I myself perform a lot of the specialties. But I'm very fortunate, and in both our Quincy location and in the Cambridge location, we have 3 pediatric dentists on staff. These are doctors that have additional training, 2 to 3 years of training in pediatric dentistry beyond general dentistry. We've got periodontists who are dentists who specialize in gums, gum treatments, the periodontia, which we call
Root
the gum, the
canals.
bone. We have an endodontist that specializes in doing root canals, endodontics. We have a gentleman who does oral surgery. So we are truly, the 2 locations are truly places where people can call their dental homes, where they can get comprehensive care, access, information, and as you've mentioned previously, Loanne is more than willing and more than happy to provide people with options and treatment planning and educate them on their insurance benefits.
And you take insurance too?
Absolutely. We utilize insurance, we utilize payment plans, not because we are trying to leverage this as a financial institution, but we're really trying to do this because we really care about our patients and we really want to give people the options. Once again, not to beat this, the economy isn't great,
No,
but people
we
have healthcare needs.
Yes.
And we need, as doctors, we need to provide our patients with options. And we certainly can't provide everybody with all that they need, but by utilizing these resources such as financing plans, insurance, mass health benefits, we hope to provide people with comprehensive care.
Now, you said today we talked about pediatric dentistry.
Excellent. That is awesome. That'd be great.
What does that mean? What is the age? Where does that fit in? From birth? The people, do you see patients?
You will not believe that the concerns regarding pediatric dentistry actually starts prenatal, meaning even before birth. Even before birth, we need to pay attention to the diet, the oral hygiene of the mother.
Yes.
This is
God.
very, very
Sorry,
important.
that's my cell phone.
That's all
Why
right.
didn't I shut it off when I'm talking to Rosaline? Well, forget it.
What I would like to talk about is that